So it's a shared patient record on a national level. Patients can opt out. It's not like, so the difference between Iceland and the other Nordic countries is that in the other Nordic countries, health professionals send information to like a like a centralized place, and then patients give their consent via their patient portal. In Iceland, it's separated. It's the electronic health record is interconnected. Everybody sees what they need to see about their patients. They are only allowed to access the patient information, but the patient can opt out. So that if the patient does not want to be a part of the interconnected health record, does not want to share his or her health information with other health professionals, they can opt out. And so far, we started this in 2014, and 3 people have opted out. So we only have one patient portal, the national health portal, which we call Heilsuvera. We called it Vera in the beginning, but now we've changed it to Helsivera. And this is integrated into the electronic health record, so we can do a lot of very nice things to support patient care and quality of services. The patient only has to access one point for everything they need to do within the healthcare system. They just log on to Heilsuvera.is, and then it doesn't matter. Then they can access they can access, for example, their appointments, and if some private practices are also physicians connected to the health portal. So if they have an appointment there, they can book it electronically, and then they can see the bookings and see the visit. Today you can view and request for e-prescriptions. You can view your dispensed medication. You can view your immunization information. You can have the secure messaging with your health professional. You can make e-bookings online, and as I told you, both within primary healthcare and with some special physician services, and we are also working on it at the hospital unit. They kind of tell if they want to make it available or not. We can make it available when they are ready. You can make organ donation wishes. You can view your allergy information. You can enter your own measurements for blood pressure, blood sugar levels, and pulse, if you have fever or so on, but those you cannot share them with your health professional. You can show your health professional, but electronically you cannot share it, but you can print them out or just open your health portal and show your health professional if they want. What COVID has taught us, that you can actually make changes within no time, something that sometimes you're working on things for a very long time, but then you have emergencies and it's just click, 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 everything clicks together and is solved at a time frame that you would not have thought would be possible before COVID-19.
No one is saying no during COVID. I can call everyone up at any time of the day or any time of the week, and they will say, "Okay, yes, I'm on it, and it'll be finished tomorrow." So it's very, yeah. Did you tell them about all the COVID test answers you sent out also through the portal?
I wasn't there yet.
Okay, sorry.
Yeah, so you go and have the test, and if you test negative, you will know within 5 hours usually, because you will get the message within the patient portal that you tested negative. If you tested positive, you will get a call from the tracing team.
I just want to emphasize that for the COVID tests, we have almost fully automated the process. So the patient just goes on, logs on, asks for the test, and they just everyone can get a test. Our testing capabilities is so high that we can test everyone that wants to have a test or has symptoms or by some reason wants to have a test, and then they only need to scan the barcode and confirm the test. So it's only 2 clicks and one thing up your nose, and then it's done. So that's the only effort the healthcare system needs to do for the COVID testing, and then this answer is sent automatically. So it used to be that you need to call your healthcare center. They would ask for the request the test, and then it went sent to the lab, and so there's a lot of different things going on there. And then they needed to call everyone, or they would send them by hand a message into the patient portal. So this was I mean, we have been doing, was it 400,000 tests in Iceland now already?
Yeah.
And the population is 380,000, something like that. So we've done more tests than people in Iceland.
304,000 Icelanders.
Yeah. So you can imagine how much time that has been saving the healthcare system for this, all of this. So the only data that is stored in Heilsuvera is things you register yourself, like your blood pressure, and so those things you can register yourself in the portal, and then the communications. So if you send a question to your doctor and get an answer, that is also stored in the portal. But everything else is either stored in your patient record or in centralized databases, like the centralized drug database and immunization database and things like that. So there's, but it's stored in. There is it's now stored at the vendor that made it, but now we have a tendering process going on where we are bids on storing all of our services. So it's Heilsuvera and the healthcare network and a lot of other systems we have are running. So it's going to be somewhere else probably in 2 months' time.
I was just going to add that we're using the same function as for the interconnected health records, because we have the Icelandic Health Net, HECLA, as Ingi said. So this is what makes health professionals able to access their patient's health record in any place, anywhere. It's the same for the patient portal. It checks where the patient has information, and the patient is able to